Hey guys, sorry about that. My time got cut off, so I'm just gonna be making this second video that you guys can access. So, talking about the history, OCD has been around and documented for a long time, as early as the 17th century. Um, OCD was eventually accepted in the mainstream once Sigmund Freud started theorizing about behavioral as well as cognitive psychology. And then obsessive compulsive disorder is the term is a relatively modern medical term. It was coined in the 20th century. However, the actual disorder itself has been around much longer than that. So, for a diagnosis, someone with OCD is going to be going through a psychological evaluation done by a trained therapist to determine um, if OCD is present. Um, it can affect people of all ages. It is genetic, so you're gonna have it from when you're born. However, the onset is different for all people, and it is diagnosed usually during someone's adolescent years. However, late onset does occur, um, and then typically boys experience onset before girls do, and it is not curable, as we kind of already discussed. However, it is manageable through treatment and some medications. This YouTube video is good. It shows a boy named Matthew. He's 12 years old. He has pediatric OCD. He is in therapy, and he has his OCD sort of under control, so it's not affecting him. But he describes how it kind of did run his life before that. So it's a quick 4-minute video. Give that a look through the slides. And then getting into the school, so the classroom placement, students with severe OCD may be eligible for a 504 plan. However, under law, students suffering from OCD aren't eligible for special education services unless it's through an emotional disturbance or an other health impairment exception. And then this will be included in the severe category. Less severe cases, students or teachers are going to work on accommodations, talking to the student themselves, as well as maybe a special education teacher, so they can provide quality instruction during classroom time. Some accommodations in the classroom: a teacher could provide extra time on tests as well as writing assignments. As well as possibly even a separate testing room to avoid any distractions or anxiety they may feel. Plan an escape route. Sorry. Yeah, this is a really good idea. If somebody with OCD may be feeling a compulsion coming on, they can discuss some safe place they feel like, maybe in the classroom or out in the hallway, that they feel they can kind of control themselves, take a breather, and um, kind of get themselves back on track. Provide an agenda for the day, so people, this is kind of good for everybody, so that people know what's going to be happening, how much time stuff is going to take, so they may not feel the anxiety of finishing an assignment. And then seating arrangements to avoid distractions, maybe not seating them next to a window or the hallway. And then some impacts teachers can have: communication is key, making sure that um, you're communicating with the students best how they feel they could best um, combat their OCD. Being patient, as well as being aware of any triggering events. And then consult a special education teacher if you need help with accommodations. And yeah, that's pretty much it. So this is my works cited, and then I have 2 questions at the end that you guys can look over and answer in the slides. So thank you, and hope you guys learned some stuff.